In health news tonight, the surge of opioid-dependent patients in this country.
It is now a major public health problem, and News 8's medical reporter Jocelyn Memento live tonight in our New Haven newsroom with the findings of a Yale study on treatment and what's being done right here in our state to help prevent addiction in the first place. Jocelyn.
And Darren, opioids or opiates are pain medications prescribed for people who need them. Unfortunately, many get addicted and others get hooked by experimenting with prescription drugs. Now, Yale researchers have found that a specific treatment led to a decrease in overall dependency.
It's estimated 100 million people in the U.S. need pain medication. But those who are addicted or overdose can find themselves in the emergency department, like this one at Yale New Haven Hospital.
Similar to any other chronic or relapsing disease, in the emergency department we screen and we often initiate treatment.
Drs. Gail D'Onofrio and David Feline did more than that. The Yale School of Medicine researchers offered them an opportunity to sign up for a multi-intervention study. They found that those treated with buprenorphine, brand name Suboxone, responded best.
So not only did we find that twice as many patients who received the buprenorphine went into treatment and stayed there for 30 days, we also found that there was a significantly less amount of patients who were in any inpatient addiction services.
The drug also addressed the patient's withdrawals and cravings.
I think they didn't realize how effective the medications were and how readily available the medications could be for them. Essentially stop using the opiates in such a brief period of time. Over usually 6 to 12 hours, they were able to stop using opiates.
Prevention is just as important as treatment in this growing public health issue. Drug companies have come up with abuse deterrent formulation medications, or ADFs.
What this is for is to prevent people from abusing the drug.
Jill Spinetti with the Governor's Prevention Partnership says ADFs also allow those who live with chronic pain get what they need.
Certainly people can still take it as it's meant to be, but usually with drug abusers they want to get high in different ways, so they can't crush it, they can't snort it, they can't break it down into powder to inject it as heroin.
Advocates are pushing for the passage of a bill this legislative session so that ADFs are covered by insurance in Connecticut.
The bill was passed by the state Senate over the weekend, and supporters are hoping for a full House vote before the session ends. Meantime, the Yale study also found those treated with buprenorphine were more likely to get counseling and address their addiction. The hope is that more primary care physicians, community health, and HIV clinics will help to expand patient access.